Welcome all. Thank you for joining us today. Today we are discussing about the challenges faced by the telehealthcare industry. And I'm glad that two experts have joined us. Dr. Aditi Joshi is a widely recognized telehealth expert, and Venkat Timmaraju is a medical statistician and founder of Oprable. Thank you for joining us. If you could introduce yourselves, if you could begin with Aditi.
Hi, thank you, Saya. As mentioned, I'm Dr. Aditi Joshi. I am an emergency medicine physician, but I've worked in telemedicine for almost a decade, running teams at a startup and then also an academic center. And now I do some consulting for digital health companies, as well as writing a book on telemedicine.
It's wonderful. How about Venkat, if you could introduce yourself?
Yeah, thanks, Aditi, and thanks, Saya. I'm Venkat Timmaraju. I come from a medical statistics background. I hold a PhD in medical statistics, and I've been within this space for about 20 years now in data analytics. And, you know, I used to be a chief data scientist for large IT firms before I started Oprable, because this is something that is very close to me, and solving the problems within healthcare and interoperability are something that I really wish to address.
Thank you, Venkat. That's been very helpful. So today we are going to discuss some of the challenges that are facing telehealthcare industry. And we have curated the top three challenges. The first one being EMR integration, second, continuity of care, and the third, reimbursements. So let's quickly jump on to the first one, EMR integration. Now, integration of telehealth platforms with EMRs can be a costly affair. And if this integration gets delayed, it can delay the deployment of telehealth care. So Aditi, if you could shed some light on this issue.
When you first started out in telemedicine, there wasn't a lot of clinics or hospital systems that were doing it. And so many of the platforms that were created for telehealth were separate from the EMR because people were really looking at a direct to consumer model. And so patients would call directly into a company. Now, that still exists, but now that telehealth has taken off and there are a lot more health systems that are using it, it is very unwieldy to have a different platform for your telehealth care than it is for your medical records, for where your clinicians are documenting. There are certain EMRs that have types of telehealth within them, but the reality is most of the ways that we use it and most of the telehealth platforms are out there are separate from the EMR. And so there has been a really strong recognition that there has to be an integrated model, that clinicians shouldn't have or shouldn't need to have two windows open, having to document in two different places, where they have to look for patient data in one place and then document elsewhere and get some other patient data within from the EMR. It just doesn't make for a holistic approach. It also adds to the burden of documentation. And really, that's one of the things that adds to burnout. So what we're trying to do, obviously, with technology is make everybody's lives easier and better for patient care. And so EMR integration is really something that has to happen for telemedicine to really take off within the health system.
Dr. Aditi, really very well summarized. Venkat, but could you just shed some light on how Operable can simplify EMR integration?
Sure. I totally understand that the initial model of telehealth was what the D2C model, or direct to consumer model, as Aditi said. And the other challenge right now the organizations are facing is, do I have my own native drone telehealth application, or should I get something added which is already existing? Now, if I don't integrate them, as Aditi said, it's going to be a lot of additional work for the clinicians to looking at two different screens. And integration is quite a piece of work, which takes a lot of time and money. And direct integrations are seldom done, and it involves quite a lot of people as well, because there's quite a lot of intricate data that needs to be connected and shared across the two platforms. Now, the challenge with that is, if you were to do that, you can't do it holistically, because the whole information cannot be shared. It would be a very long integration process. And if you were to do it minimalistically, that means you're diluting the usage of the telehealth platform itself, and that's where we come into picture, right? Operable, by definition, we are working under the try to solve the TEPCA compliance and the ONC Cures Act by delivering the data directly to the consumer as well as to the clinician when the data is needed. When the data is needed, we can facilitate that data exchange by connecting all the EMR networks that are out there through Qualified Health Information Network and provide that information back to the telehealth organizations in a fashion that they can consume all that information on their dashboards. And that's where we differentiate and make life easier. So what we bring is very easy to integrate, less expensive, and very quick to move on. And most importantly, facilitate that quality exchange between the patient and the doctor.
Thanks, Venkat. Now we really understand why you call yourself simplifying EMR integration. Very well summarized, Venkat. Thanks. This brings me on to the next question for the next challenge, really, that telehealth industry is facing. See, patients traditionally expect to see the same physician on their repeat telehealth visit. However, the telehealth model essentially cannot guarantee that the patient would be able to see the same patient. This sort of, affects what we call continuity of care, and this leads to a poor patient experience as well as a physician experience. Aditi, would you agree with this?
I wouldn't say that it was the telehealth model specifically. I just think the way that the healthcare system has become very complex, it leads to this. So I'm an emergency physician, as I mentioned, which by definition is acute episodic care. So we don't necessarily see patients all the time. They have generally primary care physicians or specialists, depending on what their health profile is, that they get to see regularly. But even in those types, we're actually finding that a lot of people, especially in the younger generations, don't have a primary care physician. So they really are doing these episodic care, even for preventive care screenings. There isn't any continuity of care in general. Obviously, when you have telemedicine, which started out really episodic in the way that we're practicing it, and for doctors to be anywhere around the country, as long as obviously they had the medical license for where the patient was, you're going to find even more of this. And so what's happened is all of these things together have created a place where it's really hard to find out what has the patient been through before. Add on top the fact that we don't have a universal health record. Patients don't usually have their medical records on hand anywhere. And then we're finding that we're just not seeing a full health picture for any patient who comes in. This obviously leads to worse care because we don't really know what's going on with patients. They may know, but we can't expect patients to know every single portion of what a health record shows because they're not really necessarily educated on it. Let's say, for example, I'm looking at a radiology report. I might look at other details in it that the patient is not looking for, but they can't be expected to look for that. And so we really need to find a place where everything is together. Telehealth can help with that if you have the medical record there with you, because really you're being able to access somebody wherever they are. For example, let's say I was a primary care physician and my patient had gone away for the weekend somewhere, maybe next town over, somewhere where I could still practice. I could still see them over telehealth. This does help with that continuity of care. But in general, because of the complexity of the healthcare system, what I would like to see is just a better way that all of the records are kept together, better data, aggregating it in a way that we know what is relevant data for this particular patient in front of me. And then eventually, I actually think that most patients will have access to their medical records on them. And then that way we can basically improve patient care overall.
Venkat, then how does Operable ensure that physicians have access to health records as and when required?
Right. I've already mentioned that we are connected to the Qualified Health Information Network and therefore have the ability to exchange data across the country for any telehealth solution or any healthcare institution that is out there. But specifically for the healthcare, telehealth point, the challenge of becoming a mainstream clinical delivery for telehealth is very much connected to, can I have the universal health record of that patient? at one place, and so that I can refer to that and have that information in a way that I can digest all that information appropriately. For example, if the patient complains on a specific topic, they should be able to get to that topic very quickly rather than clicking and clacking through the traditional healthcare systems that are out there with the EMRs, which takes loads and loads of time. We have seen patients with over 1,000 episodic data, which is, there's no way any clinician can do. And as I know, Aditi pointed out that one of the things that patients have challenge memorizing, for example, I can relate that very much to my parents, for example. All they would say is, I'm on a blood pressure medication. I'm on a, cholesterol medication. And that's all they can say. They probably can name the drug at most, but they won't be able to give the specifications in terms of the dosage. So those are the details that a clinician would obviously need, and those are the details that are missing. And that's where Operable's another layer comes into picture, which is the Viva platform, our AI-driven platform. Not only, our first thing is connection, which is Viva, Connexa, which helps the data exchange happening through the network. And second thing is, okay, I'm getting the data. Now I need that data to be parsed in a fashion that is consumable. And that's where Viva is a really, really nichely built AI tool that parses all this clinical information and structures them for any, for example, a telehealth organization doesn't have to go through different episodic information. For example, there are 12 types of episodes that can be recorded in a EMR. And then all this information is, staggered everywhere within the EMR. Now, if you were to consolidate and all, bring all of them together in a synchronized fashion, that would really help healthcare delivery. And that's where Operable specializes in with respect to Viva. And that's where we think the continuity of care would significantly improve by having our Viva solution in place.
Venkat and Aditi, I can assure you this conversation is going to be really amazing for the audience who are listening to us live, as well as the ones who are going to listen to the recording later on. So thank you for your inputs until now. We have covered two issues, EMR integration and continuity of care. Now we move on to the third one, which is reimbursements. And I believe everybody, not just within telehealth, but all across the healthcare network, are talking about reimbursements. But typically, telehealth is something that has been struggling until now as far as reimbursements are concerned. Aditi, how does reimbursements really affect delivery of care or growth of telehealth care in general?
It had quite a bit of effect, especially at the beginning. When I started, you couldn't get patients really to do it. A lot of clinicians didn't want to try it out. And, obviously it's not only that it's just a new modality or a new way to practice, but what you're really asking a lot of times when having telehealth is doing more clinical work. And so if you're going to ask someone to do that, they have to be paid for it as well. Otherwise, it's just adding to the already overburdened clinical schedules for most physicians. And so obviously nothing changed it more than the pandemic and the emergency waivers that allowed telehealth to be paid for. Now, there's two types of parity, whether it's basically payment or visit, meaning that an in-person and telehealth visit are considered to be the same, or whether they're at least charged in the same way. So, you look at those two things, and depending on the state, most reimburse it in some way. Now, they have been extended because a lot of the issue after the emergency waivers are whether they're going to stay in place. And so far they have, which is great because it means that there's at least some incentive to grow this model. And this is why we have seen it grow, because now there is reimbursement. People can get paid for their telehealth. We obviously need to make sure that that stays. And then while we are able to grow our reimbursement, there has to be a way to actually collect the billing, whether it's in the EMR, whether it's in the platform, wherever it is that you're doing it, it has to be collected. I will say that most of the telehealth platforms that I've seen, they have that in there. They realize this. This is a very common thing that they know has to be in there. And so it's really about understanding what you can reimburse for, being able to process it, and that's just lobbying and advocating that this reimbursements keep being extended and maybe be codified into law.
Thanks, Aditi. Venkat, but I would assume that you have a much simpler way to, help our telehealth vendors as far as reimbursements are concerned. Could you please elaborate?
Yes, sure, Saya. So one of the things is, ability to kind of have those CPT codes that are available and what the patient is going through in their life, and collate all of them together and create a care plan that supports a appropriate reimbursement plan is something that telehealth can take advantage of. And the challenge has been, again, not having the data that connects or solves the problem. Okay, now the data is parsed and structured through Viva, and that solves the problem of structuring the data. Now, it is a very simple overlay based on the requirement of a telehealth solution. I just need to follow up these codes because a telehealth solution would obviously be targeting at a specific therapeutic area, if not a general thing. So you'd be able to collect all these codes and create and facilitate this data back to telehealth solutions for appropriate reimbursement. That's one part. And second part is, one of the challenges of telehealth is because there are too many of them right now, and there needs to be a certain consolidation that will happen downstream. When that happens, there are two ways to grow. One is to acquire, a larger one, acquiring more and more companies, or a existing one acquiring more and more, or solving more and more problems by increasing their revenue. And in order to do so, you need to understand about your patient population, right? If you have a better understanding about your patient population, telehealth services can add on additional services that can be reimbursed within the framework that is out there. And then, as Aditi pointed out, we can also lobby for additional services if we start showing value by delivering these telehealth services remotely. Right, these additional services remotely through telehealth, you could argue that you could take the additional burden away of the patient going and visiting the doctor in person, right? And therefore, that increases the telehealth revenue model and the way that telehealth can grow. And therefore, we are definitely in a spot where we can support this through our application.
Venkat, the way you addressed it, it's really has been helpful. I've been taking notes all throughout this conversation. Now we are almost at the end of today's call. I would request both of you to end your make your closing remarks on one topic that is being discussed across meeting rooms as well as on social media, and that is how could we make telehealthcare more patient-centric? If Aditi, you would like to begin.
I think we're already seeing that, right? For a couple of reasons. One, just with the expansion of technology in general, we have a lot more information in our hands. And this is following within the healthcare system. And I mentioned before that eventually the patients will have more of their medical records. There are already laws that they should be able to get their results, right, already within, and their medical records in general. And this is only going to continue. But to answer your question about how do you make sure that it's more patient centric, we have to get them involved and also, in whatever innovations are being applied. They're one of the stakeholders. So you see a lot of design thinking. You see a lot of companies now have patient advocates, patient consultants to try to find out what is the patient experience. Because it's one thing for me to go through the patient app side on a telehealth platform and try to determine, does this seem easy, versus an actual patient is going to use it. It's more valuable to get their input, not mine, because, and I should be inputting on the clinician side, but they should be really getting their opinion and their insight into it. And I think we're going to see more of that. There is a lot, it's definitely a push for that. And we're only going to see more patient advocates speaking up, being open and insightful on social media, and being part of these teams as well.
Venkat, please.
Sure. In order to treat a patient, right, in order to be patient-centric, there are two parts that we need to do. One is properly understand the patient needs, and then create a treatment plan. And then that's not going to be end of it. And I've done my work as a clinician. Looked at the patient, asked all the right questions, and documented everything, and then I prescribed a medication or a treatment plan, whatever that is. And then the second thing is I need to make that patient adhere to this plan. That's the challenging part, and that's where telehealth can actually increase the patient-centric model by using this data and nudging the patient to do appropriate things at the right time, and making sure that they're adhering to plan. For example, 50% of the people don't even take medication on time. You know, that kind of statistic is sounds ridiculous, but if you were to have a proper telehealth solution that is nudging your patient and monitoring their adherence, and then asking them to take medication, and not only the app, which is just easy enough to use, but helping them on a day-to-day basis to make sure that they're taking time to relax themselves or do whatever that is needed to improve their quality of life. That is very important, and that is where the patient-centric approach needs to come in. And there's a huge value add that we can bring, because as Aditi said, there's quite a lot of discussion that is going on, how to not only bring the patient, making the application usable to the patient, but making sure that they are adhering to this one, adhering to the care plan that has been given to them. And in order to do so, you need more analytics that supports individualization and personalization of care. And that is where telehealth can go forward, to improve the patient-centric care.
Thank you, Venkat, and thank you, Aditi. Your comments have been really insightful. And I also thank all the audience, the healthcare professionals who have joined us live on this call. We look forward to delivering, making more such webinars, videos on healthcare content that really adds value. Thank you again for joining us. If you have any questions, please write to us on the email ID that you see at the bottom. Thank you once again.